Welcome to the Health Admin Life podcast. My name is Brooke, and I'm going to interview special guests to explore the vast career opportunities in health administration. Whether you're a clinical professional, a corporate worker, a student, or a patient yourself, this podcast is for everyone. Get ready to be inspired. Hello, current and future healthcare leaders. Welcome to the Health Admin Life podcast. My name is Brooke, and today I would like to welcome you all to the third bonus Q&A episode. On Instagram, I sent out a survey to find out what pressing questions you had and how I can help answer. So today I'm going to answer the next three questions, including how to choose an administrative fellowship, the best majors for health administration, and the type of entry-level roles you can go into to get your foot into the door to gain experience. So for the first question, how to choose a healthcare administrative fellowship. So choosing a healthcare administrative fellowship really requires you to think about your career goals, your different interests, the opportunities available, and there are steps to really help you make that decision. So first one would be researching different fellowship programs. Number two would be defining your career goals. Three would be evaluating program features. Four, assess your support and different resources within that program. Five, consider location and organizations. Six, the application process. And lastly, number seven, make sure you seek advice as well as talk to your network. So going back to that first one, which is researching fellowship programs, you'll want to look for different fellowship programs that are accredited, whether that's CAMI accredited or other accreditation offerings, and make sure that this is a reputable healthcare organization, hospital, or academic institution. So make sure you look at their website, program description, the application requirements to really gather enough information for the structure, duration, focus areas, and the skills necessary for that opportunity. Number two is to define your career goals. So you want to think about what do you want to get out of this fellowship, but also what do you want to do long term. So to determine that, think of different areas you want to go into, whether it's operations, finance, policy, supply chain, or even quality improvement. And I know it's probably hard to know exactly what you want to do yet, but start thinking about, okay, what maybe don't you like doing, and that can help make your decision. Consider how this fellowship program really aligns with those goals and offers different opportunities for professional growth. And then nextly is evaluate your program features. So consider the curriculum, different rotations. So if it's project-based or rotation-based, how long the program is. Most of them are either 1 year or 2 years long. Also look into the different mentorship programs, networking opportunities. Make sure you look for a comprehensive experience that really exposes you to different aspects of the healthcare institution, but also health administration, because there's so many areas you can go into and so many different roles you can go into as well. And again, with evaluating the program features, make sure you consider the reputation and connections of the organization, as well as their previous track record for producing successful leaders in the future. The next one is assessing the support and resources. So look for fellowships that really offer dedicated support and resources for professional development. So these would be things like training, conferences, continuing education opportunities like certifications, and make sure you have the certain level of mentorship. For instance, you want to make sure, I know what was important to me is making sure that I had multiple mentors in the program that I went to, had at least 4 different mentors, whether that was an alumni mentor, advisor, rotation manager, and even other opportunities for mentorship. And then lastly is looking at the networking opportunities. Can you network within the organization or even after the fellowship? What are those opportunities there? Next, consider the location and organization. So evaluate the location of the fellowship and its impact to your personal and professional life. So is this going to be online? Is this remote? Is this hybrid? Also, it's the geographic location. So what state, what country, those really do matter. Because if it's one location, one specific hospital system, is this going to be in one state, or are there multiple health systems throughout the country? So thinking of those long-term goals, where do you see yourself going? Because usually they want to see you at least stay another year, and they want to see you stay honestly for a longer term than just a year. So with that, that's definitely important, and make sure you're aligned, not only with the location, but make sure you understand their culture, their values, mission. So making sure that it aligns with your values as well as theirs. Next is the application process. So reviewing the application requirements and deadlines for the fellowship program you're interested in. This is important so you don't miss those dates, or you can combine different applications together and submit them all at once, which makes it so much easier. So with the application process, make sure you have a strong application that highlights your different skills, your experiences, whether it's part-time work, full-time work, it doesn't matter, or even internships. Volunteer experience will be crucial to really show, okay, this is what you want to go into. And also think about, again, your future goals with the application process. And then lastly with this is seek advice and talk to your network. Make sure you reach out to previous fellows to gain insights of their experience and what the company culture and actual fellowship is really like. So this will also help you have a better chance of solidifying a fellowships too. So don't be afraid to reach out to them, as well as don't be afraid to reach out to your professors, because you pay so much money for tuition and they should be assisting you during this process. And something else that you can help network with is other professionals in the field. You can reach out on LinkedIn, or even think of the alumni who may have good advice and give you guidance or recommendations. So that is that for fellowships. Now for the next question. What are the best majors to go into for health administration? Now, really and honestly, there is no single best major for health administration. There's so many different fields of studies you can go into and still have a strong foundation to start your career in health administration. And the reason why is, think of health administration kind of like, I would say, a business in itself, where there's so many different areas within healthcare. You'll need finance, you'll need HR, you'll need people to organize food and supplies, as well as the other clinical staff to be involved with. So there's so many different avenues. So that's why you don't have to have one specific role or major. You can go into really specialized or keep it broad. But some majors that you can consider going into would be health administration or healthcare management or healthcare service administration. Next would be business administration or management. A lot of business degrees are really good for this. You could go into more specialized like finance, HR, and a big one too, I would say a lot of people go into public health. They do overlap, but if you do public health, I would also make sure you do have a good foundation, honestly, with leadership, management, as well as finance if you can. Another one is going into economics. And a big one nowadays, honestly, is health informatics or health information management, because this is kind of the data analytics, the also IT side of it. So a lot of healthcare IT or data analytics is so crucial nowadays. So that would be a great major to go into too. And with majors, you can have any bachelor's, honestly, and then also have any master's, but just make sure they kind of align with your long-term career goals and what specific niche do you want to go into within healthcare. And again, you don't have to have a specific niche, but it could help too. And that is it for majors. Now for the third question and the last question, number 3, are what are some entry-level roles that you can gain experience going into healthcare administration? And to gain experience and to get your foot in the door, you might want to consider different roles like being an administrative assistant within, let's say, an urgent care or health system. That's usually a great way to get your foot in the door. The next one has multiple names for it. So a lot of times they call this a patient services representative or patient access associate. So what that means is really I would say, front desk receptionist, or on the back end, the call center. So a lot of those roles, and even myself, that is how I started. And I found that a great opportunity to not only gain experience, but also, again, to get your foot in the door. And you can go so many different health systems with that experience, or even you could think of long-term care, going into nursing homes or even different types of facilities there. Or you could say even med sales, and great transferable skills. The next job would be a health information technician. So thinking of medical records would be great, or health information could be that data analytics side. Again, there's so many different names and it's not easy to understand when you're applying for jobs. So make sure you kind of read those job descriptions to really see what the job and duties entail for entry level. Next would be quality improvement assistant or quality improvement coordinator or quality improvement intern. This is also one of the areas that I personally love. You can also call this continuous improvement, process improvement. So many organizations need this, whether it's improving, let's say, a service line, which is, let's say, if you're working within the OBGYN clinical leaders, how can you make their processes better? Or you could even say supply chain. They'll always need like a quality improvement engineer. So quality improvement, I think, sets a great foundation, helps your mind think of how to strategize and solve problems. And you can go into, honestly, any area after that. Next would be a project coordinator, similar to a process improvement. So project coordinator could be like a project manager, project assistant to start out. And those are also great transferable skills. And then the last two are operations assistants or research assistants. And those are more specialized, but great things to consider as well. Now, remember, with all of these roles, it may vary with their responsibilities, different opportunities, different practical experience. So you'll want to learn about the intricacies of healthcare administration to develop those transferable skills that will help benefit your career long term. So where can you find that good foundation? But again, there's no wrong choice. There really isn't. You just need to start somewhere. And even working part-time, interning, volunteering, getting your foot in the door is really key to set you up for success in the long run, because you're going to be working with so many leaders that have so many years of experience in health administration. Even though that sounds like a big title in a big area, there's a lot of smaller roles that you can go into and you have the opportunity to go into. So don't think there aren't opportunities. There really are. And on that note, I hope this really helped you, and I hope you enjoyed this third Q&A. So for the future, make sure that you check out Spotify or Instagram to request questions that I can help answer in the next bonus episode. But I want to thank you all for listening. And if you want to listen to more episodes, make sure you check out the link in my bio at Health Admin Life on TikTok, Instagram, or YouTube. Today's show is brought to you by our sponsors, Riverside and Spotify for podcasters.